Okay, we're going to locate some of the structures of the wrist and hand now. We'll go ahead and start with the radius and the shaft of the radius. So we've palpated this before with the elbow, but we can follow the shaft of the radius down all the way to the distal end of the radius, where it becomes the radial styloid process. So right here, the radius flares out a little bit and forms a little outcrop right here. And then at the very distal end of the radius, there's a little pointy piece of bone right there called the radial styloid process. So you can find the end of the radius and just push your finger down in the bottom of that and feel that radial styloid process right there. We can do the same thing on the ulnar side, following the ulnar shaft down to the ulnar styloid process. And we can find our way inside the wrist here at the distal end of the radius and palpate that little pointy end of the ulnar styloid process as well. Back up here on the dorsal side of the wrist, we have a little outcrop of bone on top of the radius called Lister's tubercle. So Lister's tubercle is a little ridge of bone on the top of the radius that runs in this direction. So if we palpate it transversely, you should be able to feel that. So Lister's tubercle works as a little pulley system to redirect the tendon of the extensor pollicis longus, which we'll talk about in just a few minutes here. If we turn the wrist over, we can also palpate the radial artery and the radial pulse. So I'm going to have Dr. Stevenson go ahead and flex the wrist, and we can see the tendon of the flexor carpi radialis coming down right here. So if we go between the tendon of the flexor carpi radialis and this lateral edge of the radius and just palpate in there, then we should be able to find that radial artery. And right there I get a pulse from Dr. Stevenson. Okay, next we'll move on to some of the carpal bones of the hand. So just to divide the hand up, we have the proximal and then the distal row of carpal bones, and then we have the metacarpal bones right here, and we have all the phalanges up here. So we're going to talk about these carpal bones here. So the way I like to palpate and divide the hand up is to divide it up into columns. So we're going to talk about the radial column, which is basically this first and second digit, as well as the scaphoid and the trapezium and the trapezoid bone down here. So all the way down here. So the third digit is the central column, and it goes down this third metacarpal and includes the bones of the lunate and the capitate. And then we have the ulnar column with the fourth and fifth digit, and that includes the bone, the triquetral bone, the pisiform bone, and the hamate bone. So let's go ahead and talk about this radial column first. So at the base of the thumb, we have a bone called the trapezium. And if we palpate right here at the base of the thumb, if we follow this first metacarpal down and palpate right here at the base of the thumb, you should be able to feel a fairly large bone that sticks out anteriorly. That is the trapezium, and it's got a little tubercle on it that serves as the attachment site for the flexor retinaculum, or the transverse carpal ligament that runs across to form the carpal tunnel. So this bone is fairly easy to palpate if we just work our way down this first metacarpal, and once we get to the base of this first metacarpal, if we just jump over that joint line, we'll be right on top of the trapezium. Okay, we can do the same thing or something similar with the scaphoid bone. So if I have the patient open the hand and extend all the fingers, he forms this little anatomical snuff box. So this is the tendon of the extensor pollicis longus and extensor pollicis brevis right here. If I palpate between those two tendons, right at the base of the thumb, I'll be right on top of the scaphoid bone. And this bone is important clinically. You'll probably see this if you work in an orthopedic setting eventually. When someone falls on an outstretched hand, a lot of the times this scaphoid bone is involved because it's one of the major weight-bearing bones of the carpal bones in the wrist. And then we also have the trapezoid bone. So if we follow this second metacarpal down proximally, we can follow it all the way down till we get to the base of that second metacarpal, and if I drop over the top of the base of that second metacarpal, then I'll land right on top of that trapezoid bone. Okay, next we'll move on to the central column. So if we follow this third digit down and follow this third metacarpal all the way down, we'll eventually get to the base of this third metacarpal and we'll run into the capitate bone. So if I drop off the base of this third metacarpal, I'll be right on top of the capitate. And this should be fairly close to in line with Lister's tubercle and this third metacarpal right here. So if I have Dr. Stevenson flex the wrist, this bone should really pop out at me right here. And if he extends the wrist, this bone should kind of disappear and leave a little hole. So flexion should make it more prominent, extension should make it disappear a little bit more. If I move down again to this proximal row of carpals toward Lister's tubercle, that's where I'll find the lunate. And if I find Lister's tubercle and drop right off Lister's tubercle and then move just a little bit in the ulnar direction, then I'll be right on top of that lunate bone. So these bones aren't directly in line with each other. The lunate is a little bit more to this ulnar side and the capitate is a little bit more to this radial side, but they still line up fairly well with that central column. Okay, so now we'll palpate the bones of this ulnar column. So if I follow this fourth and fifth digit down and land on top of the fourth and fifth metacarpals, I can follow those all the way down to their bases. And right at the bases of the fourth and fifth metacarpals, if I roll over the top of those bases and land on this distal row of carpals, I'll be right on that dorsal aspect of the hamate bone. So the hamate bone sits right at the base of this fourth and fifth metacarpal. So I can palpate this posteriorly here, or I can turn him anteriorly and do the same thing. So just at the base of this fourth and fifth metacarpal, I have the anterior hamate, and right here in the palmar side of the hand, the hamate has a process called the hook of the hamate, and again that serves functionally to as an attachment site for the transverse carpal ligament to form the carpal tunnel, and it also forms the tunnel of Guillain with the pisiform bone, and that's where the ulnar nerve runs and the ulnar artery. If I go to the distal end of the ulna here and drop off this distal end of the ulna near the styloid process, I'll run into the triquetrum or the triquetral bone. So let's do it from this direction. You're good right there. Now you're good right there. So if I follow this ulna all the way down to the ulnar styloid process and drop off that, the next bone I run into, which is a fairly large bone at the wrist here, is the triquetral bone or the triquetrum. That sits between the hamate bone and this ulnar styloid process, and it's a fairly large bone and very easy to palpate in the wrist there. So if I do some ulnar deviation, or excuse me, if I do some radial deviation, that bone really pops out, and if I do some ulnar deviation, that bone disappears down in the wrist. So you can see that bone kind of pop out with some radial deviation that way. Okay, just on top, on the palmar side of that triquetral bone, we have the pisiform bone, and that sits right at this medial corner of the hand right here. And it's actually a sesamoid bone, so it'll actually move around. So you can actually get a hold of your pisiform bone and move it back and forth like that, but it sits right on top of that triquetral bone. A little trick here that I like to use, if I put my distal phalange of my first digit right over the top of that pisiform bone, my thumb is going to land right on the hook of the hamate. So this pisiform bone here and this hook of the hamate form a little tunnel right in here called the tunnel of Guillain, and that ulnar nerve and ulnar artery run right in that tunnel of Guillain. So if I put my hand right back there, if I put my thumb right back up here on the pisiform, and I'm palpating with the tip of my thumb the hook of the hamate, then I can drop into the tunnel of Guillain here, and sometimes if you're being very detailed and the patient's thin enough, you can feel that ulnar pulse or that ulnar artery right there, and you can actually roll over the top of the ulnar nerve right there and get some nerve type symptoms in this fourth and fifth digit of the hand. Okay, as I mentioned previously, we've also have the carpal tunnel. So the carpal tunnel is formed by some of the bony structures of the carpal bones at the wrist, and one of those structures is the tubercle of the trapezium, and the other structures are the pisiform and the hook of the hamate right here. So these stick up a little higher relative to the other carpal bones and form the tunnel that you can kind of see in the hand that runs right there through the hand. So there's a transverse carpal ligament that runs from the tubercle of the trapezium over to the hook of the hamate and the pisiform bone right here, and the tendons of the flexor digitorum superficialis and flexor digitorum profundus, as well as the flexor carpi radialis and the median nerve, all run through this tunnel right here. Okay, next we have the metacarpals, which we've already mentioned. So the metacarpals are distal to that distal row of carpal bones. So we have the first, second, third, fourth, and fifth metacarpals, and then all of the phalanges, which are really easy to palpate as well. Okay, next we're going to go through some tunnels of the hand. So these tunnels are basically tendons that run together that cross from the forearm over the wrist. So tunnel 1, if I have the patient open the hand again and take a look at this anatomical snuff box, we have two tendons that run together right here. The first tendon on the most radial side is the abductor pollicis longus tendon, or the APL tendon, and that runs along with the extensor pollicis brevis tendon. So this looks like one tendon right here, but you can actually, if you palpate in detail across those two tendons, you can actually split those two tendons apart, and that's tunnel 1 right there. So again, abductor pollicis longus and extensor pollicis brevis running together right there. Tunnel 2 is the extensor carpi radialis longus and extensor carpi radialis brevis. So if I have the patient extend the wrist, these are two large tendons with the extensor carpi radialis longus going to the base of the second metacarpal and the extensor carpi radialis brevis going to the base of the third metacarpal, crossing the wrist right there. So you can see the two tendons crossing right there. So that's tunnel 2. Tunnel 3, if I have the patient open the hand again, is this extensor pollicis longus, and we've already talked about this. The reason this is tunnel 3 and not tunnel 2 is it goes all the way up here and around Lister's tubercle, so it's actually more medial than the other tendons, but it crosses underneath this extensor carpi radialis longus and brevis and goes all the way to Lister's tubercle and then up into the ulna right here. So that's extensor pollicis longus. The next tunnel, tunnel 4, is the extensor digitorum and the extensor indices. So remember, the extensor digitorum, if I have the patient extend the hand and the fingers, this is running right down the center of the wrist right here, and these tendons fan out to each of the individual digits right here. And the extensor indices is the same thing. It runs across the wrist and goes all the way to this second digit right here. But this is tunnel 4 running across this dorsal side of the wrist right here. Tunnel 5 is the extensor digiti minimi. So if I just have the patient extend this fifth digit, there's a little tendon on this radial side of the ulnar styloid process that runs down and runs across the wrist right here. So that's tunnel 5, the extensor digiti minimi. And then tunnel 6 is the extensor carpi ulnaris. So if I have the patient extend the wrist and do some ulnar deviation right here running across the ulnar styloid process, you can feel the tendon both proximal and distal to that ulnar styloid process, and going all the way to this fifth digit right here is the extensor carpi ulnaris. Okay, a few of the muscles, the intrinsic muscles of the hand that we're going to cover today. We're going to start with the thenar eminence of the hand. So the thenar eminence of the hand is right here on this proximal side of the thumb. The most superficial muscle right here in the thenar eminence is the abductor pollicis brevis muscle. So if I have the patient abduct the hand or abduct the thumb toward the middle of the hand, then that will activate this abductor pollicis brevis muscle. Okay, if we go to the hypothenar eminence of the hand, that's this area of the hand below the fifth digit. The most prominent and superficial muscle right here is the abductor digiti minimi muscle. So if he abducts the fifth digit here, that should activate this this medial side of the hand, and you should be able to feel the muscle belly of that abductor digiti minimi. We can also palpate the lumbricals of the hand. So the first through fourth lumbricals sit between the metacarpals here on the anterior side of the hand. And the lumbricals function to flex the metacarpal phalangeal joints, so these joints right here, and extend the rest of the digits here. So if we get in this lumbrical grip position like this and palpate between each of those metacarpals, you have to palpate through the palmar aponeurosis, so it's a little bit more difficult on this palmar side of the hand. But as he activates these, I should be able to feel those muscles contract between each of those metacarpals. And then lastly, we have the dorsal interossei muscles. So the dorsal interossei have a similar function as the lumbricals. They flex the metacarpal phalangeal joints and extend these other joints, but they also do some abduction. So they abduct away from the midline of the hand. So they can pull the third digit either way, but they pull the first digit this way. So this is the first dorsal interosseous right here. If I have the subject lift his pointer finger up toward the ceiling, I can feel that between this first and second metacarpal. That's this first dorsal interosseous is the easiest one to feel, and I can feel that activate right there between that first and second metacarpal. I can go through between each of these other metacarpals and feel the second, third, and fourth dorsal interossei by having him abduct the hand or flex the metacarpal phalangeal joints as well.